Hello, my name is Kenny Wu, and welcome to an Naloxone Community Educator Program. Today, I will teach you how to reverse an opioid overdose by using Narcan Naloxone. Narcan is a brand name for naloxone, and it can be administered as a nasal spray, which I have here. You will use Narcan Naloxone if you suspect an overdose, even if you're not sure which drugs were taken. It only works on opioids, and is safe to use even if opioids are not present in the system. What are some common opioids? For example, heroin and painkillers such as OxyContin, Percocet, Vicodin, and methadone. And also works on fentanyl, which is an opioid that is 50 to 100 times stronger than morphine, heroin, cocaine, crack, and other street drugs, which may contain fentanyl, which cannot be detected by sight, taste, or smell. What are the signs of an opioid overdose? You may see that the person will be unresponsive or unconscious. You may see that the person will have slow or stop breathing. You may also see blue or gray lips or fingernails. For people of color, please check the earlobes for bluish color. You will also check inside their lips and the whites of their eyes. And you may also see snoring or gurgling sounds. If the person is unresponsive, you will try to wake them up. First, check for your safety. Then, you will shout loudly in the ear and tell them you're going to call 911. For example, "Are you okay? Are you okay? I'm calling 911. If there is no response, then you will grind your knuckles up and down between their chest bone, like this. This is called a stir rub. If the person wakes up, keep them awake and keep naloxone nearby. Stay with them until they're fully alert. But if the person doesn't wake up, it's an emergency and you will have to call 911. If a person is overdosing and it is not responded to a stir rub, please call 911 for help. The 911 Good Samaritan law provides protection with some exceptions to someone overdosing or anyone calling 911 to save a life, even if drugs are present. First, let me show you what's inside of the kits. You will have 2 doses of Narcan Naloxone, information over the medication, this training in English and Spanish, a breathing shield for rescue breathing, gloves, and a certificate of completion. How to give Narcan Naloxone is very easy. 3 P's: peel, place, and push. First, you will peel the package and remove the device. Peel it. You will pull the nozzle in either nostril until your fingers touch the bottom of the person's nose, and then you will press. Do not press the plunger until the nozzle is in the person's nose, and all the medication is dispensed once the plunger is pushed. You'll wait for 2 minutes. If no response, then you will give the second dose in the other nostril. Like I said before, peel, you will place it in the other nostril, all the way aside, and then you will push. If the person starts responding after the first or the second dose, please put the person in a recovery position, with their head tilted back slightly to open their airways, hands supporting their heads, and their knees stopping their body from rolling onto the stomach. Please watch the short clip about the recovery position. When not given naloxone or the person starts to breathe, you will put the person in the recovery position so they don't choke. The first thing to do will be you will extend their arm straight across. Then you will put the other arm and cross it over like this, as if they were going to sleep. And then you will put this leg and roll them over like this. Make sure you tilt their head back just a tiny bit so they don't choke. If the person is not responding after you've given 2 doses of naloxone and you call 911, you can go ahead and do hands-only CPR. The first thing you have to know is to make sure that the patient is facing up. And now you will put your hands, you interlock your other arm in between the fingers like this, and use the heel of your hand in between the chest, in between the nipple line, right in the middle of the chest, okay? And then you push down 1.5 inches. I'll do it one time, first time, like that. And how we usually do it is to the beat of the song Staying Alive. So repeat after me, it'll be like this. Staying alive, staying alive, staying alive, staying alive. If the person wakes up after the first dose or the second dose, the first thing you have to do is tell the person who overdosed what happened. Naloxone generally works from 30 to 90 minutes, but may cause withdrawal symptoms such as chills, nausea, vomiting, and muscle aches. If the person doesn't want to seek medical attention, make sure you stay with the person for at least 3 hours. Now it's your turn.